Hi, everyone. It's Dr. Annette Mercatante from the St. Clair County Health Department. A little froggy today, but I'm here to answer your questions and talk a little bit about not just COVID, but some of the exciting things that we have lined up for the community. So let's get to the data and go over some of that good news. Of course, the bad news, our total counts are 40,000 plus cases cumulative since the onset in 2020, with unfortunately over 800 deaths. This week, though, we've certainly seen some ongoing reductions with about 100 plus new cases average over the last 7 days, and 6 COVID-19 deaths reported to us. We're down to a 5% positivity rate. Yay. So this is our graph. You can see where we've been. What a long, hard winter it has been. You look at this graph, that uptick starts way back at the beginning of November. And we went up and then down a little bit and then up again. And here we are finally coming down to what appears to be a baseline. I don't know if we're there yet, but anywhere from here further down lower is going to be a good place for us to be and to stay, hopefully for a little while. Next graph is our immunization draft. And you can see, I guess the good news is there are still people every single week who are getting vaccinated for the first time. So there's hope there. Second vaccinations and booster shots remain the predominant type of vaccine, but vaccine are ongoing. And we'll talk about the benefit. I've heard a few little still hear comments out there, well, the vaccines are no good. They failed miserably. They have not. People, the vaccines have not failed. They have been a godsend to us in this pandemic. Let's take a look at what we know after thousands and thousands and thousands of cases, vaccines, and data collection points. This is Michigan collected data, not just ours here at the county. This is statewide data. It shows rates of COVID cases. This first graph is just the cases. The dark black line on the top are cases that have been in the unvaccinated population. Then you can barely see it on this slide. I apologize, but the broken line above that is the fully vaccinated but no booster. And then the light blue line, the solid blue line at the bottom, is the fully vaccinated with booster doses. So you can clearly see that if you're fully vaccinated and boosted, you have much less reduction in cases. In fact, your risk of testing positive for COVID is 4.5, almost 5 times higher if you're unvaccinated. And let's go to the next slide, as I think this next slide is even more dramatic. And this shows vaccination status with deaths. Okay, so the top black line are the deaths associated with unvaccinated individuals, and these are just people who have died from COVID. Okay, and then the two lines on the bottom, the broken line and the solid blue line, those are individuals who have died that have both been fully vaccinated with and without a booster dose. And you can see that being vaccinated, even without a booster dose, markedly reduces your risk of dying. In fact, it reduces your risk of dying by 88.5 times. So when someone tells you vaccines have been worthless, they're a joke, they're not. And I would just add that our safety data continues to be robust and extremely favorable. No further red flags or surprises after millions and millions and millions of doses of this vaccine. And that's using 5 separate surveillance systems that are all actively tracking people who've been vaccinated and things that might happen to them over the short period after they've been vaccinated. So this is all good news, and I would urge all of you who are holding back on vaccinations to get started now, because we don't expect COVID to go away. We're hoping it'll stay low for a while and give us a break, but there's certainly a lot of anticipation and watching for when we're going to get challenged by it again. It's a good time to prepare. Next slide. So source of great confusion, including to me. I was gone for a week, came back and like, what's happened? So the CDC has switched gears. They are switching gears. They're in a period of transmission. In fact, if you go to their site, you will see both of these graphs on their website. The one with all the red is the graph of community transmission levels, where they're really heavily relying on case counts. all those positive tests are getting reported, and they're down basing that on how many positive cases per 100,000, and developing this. And this is what we've been using quite for a long time. Now, what we're transitioning to is the graph on the right, and that focuses more on community levels of impact of COVID. And what they're using mostly for this, although they are using cases per 100,000 as one indicator. They are, right? Yeah, it's still one of the indicators. But the other is what they're using is hospitalized data, people who are hospitalized and the percent of inpatient beds that are still available. So with that revised data, you can see what we're really looking at here is very much the same what we look at in flu seasons, where we look at the impact of this virus on the community, which is really the impact is really about the severe illness that it's causing. So this is where we're going. If you look at our county, if you zoom in, our county, based on this new community level, is still in the high range. And that's only because we remain slightly above the greater than 20% of new COVID admissions per 100,000. And I might add, I did want to add that this hospital data for St. Clair County is not just St. Clair County. They use a hospital service area, which is an area where people tend to come from to be hospitalized in those facilities. And so this data actually represents a wider range, regional range than just our county. Probably portions of Macomb, certainly portions of St. Clair County. It's not really clear exactly how much, but you have to remember that this is kind of a change and a shift. So what this tells us is, although we're coming down, we still have a pretty high or a higher burden of disease in our hospitals. We like to see that come down. This graph, by the way, these levels of community levels are adjusted weekly by the CDC. So we're not going to see that day-to-day variation that we've been watching for on our own websites, and even on the MyStart maps, which I don't think they were daily either, were they? The MyStart maps, no, but they were more than once a week. Yeah. So we have a week-long lag to wait before we see this come down. Do I expect us to see come down? Yes, we do. We would expect us in the next iteration for us to be either in the medium or the low range, but I don't know. I should have asked you that. When is that going to be adjusted? Do you know when it's coming out? Next week, Monday or Tuesday. Not this week anymore. Okay. Nobody does anything on Fridays, if you've noticed. Okay, next slide. So hopefully that'll help you understand like why we're still kind of shifting between these things. And then this is the a close-up view of the community level defined by the CDC case rates. If you're fewer than 200 per 100,000 or greater than 200 per 100,000 over the last 7 days, we are under 200, right? We are 100. We just said that we were under 100. We were about 100. The other indicators are new COVID admissions in the last 7 days, percent of staffed inpatient hospital beds. And we just talked about that. That's more of a regional, and that's not a countywide thing. So we're going to be using this to primarily guide us, although the state has also released kind of a new guidance for how to look at COVID transmission. And I'm going to go over that as well really quickly. This next slide. The states is much broader. It really doesn't have numbers assigned to it. This is being left to, I think, consultation between us and the state, and more of looking at the regional pictures of what's happening. But really, it's a 3-phase cycle. There's the response phase, which is the surge we just went through, then into a recovery phase, which is post-surge, which is what we're in now. Post-surges, we expect to last the longest. But this is when we want to encourage vaccines, have people kind of relax a little bit, maybe lower some of our mitigation strategies, but strengthen some of our community support for things like vaccination and education, and empowering community members to start making the right decisions about how to protect themselves and those around them. And then the third or the next cycle is the readiness phase. And this is when we anticipate another surge. So we're looking at the data that's coming in throughout the world, throughout the country. We're seeing variants that are spreading. We're seeing other issues that make us concerned that we're in for another run. And we will start communicating that to you and discussing how to bump up your mitigation and how to try and protect yourself, making sure that we have enough supplies, gearing up our vaccinations access. So those are the 3 phases. And again, they're not clearly connected to numbers. And there's a lot of discussion about when will we know we're in one phase or the other. And all I can say, that's the work of public health, and that's what we're busy doing when we're not talking to you all. We're discussing and concerned with all the other things that are happening. There's also, if you notice, not any specific indications for when to put a mask on or when to take your mask off. Masks are always the biggest issue. And again, that's because a lot of this is going to rely on who you are, what your circumstances are, and what is the environment you're living in. So a lot of personal responsibility is going to go into this. Although high risk congregate settings, hospitals, nursing homes, schools, all these areas that we have a lot of vulnerable people put together, obviously they're going to have to make decisions as well on their facilities, how they want to discuss strategies to control spread. And we'll be dealing with each one of those individually. Okay. Next slide is just our same old. It's our dashboard. Are we updating our dashboard now weekly? It's still daily now. Warning. We're going to get to the point where we're going to be updating this dashboard on a weekly basis. We could use our one and only data staff, Brandon. I'm sorry. Keep looking at you. He's the guy that I look at all the time and says, is that number right? Right? But we could certainly use him for the myriad of other amazing work that we do at the health department. And it takes him every hour of every working day to do these daily updates. And so we just really need to adjust and look at some of the other important health issues are going on in our community. Okay, so what am I talking about? Talking points.
All right.
I got it.
Yes.
Okay.
All right.
I got
You're
it.
doing great. You're doing great.
Thank you. Let me take a sip. Mr. Frog is with me today. All right. So, most importantly, we went over the updated CDC guidance in the recent weeks. The CDC is still, I'm sure we're going to see some revised guidance from the state. In fact, I just missed a state call today. Some updated guidance on quarantine and isolation. I think there's going to be some updated guidance from the CDC. So stay tuned. We're just in another one of those phases, people, where things are shifting. You can call it flip-flop. You can call it changing our mind, but the reality is our situation has changed, and for the better. So this is all really good. We all want to just kind of try and adjust, and we don't want to stay in lockdown behind our masks the rest of our lives. So we're just going to have to get used to this. And the new tool, we talked about it. So it's a good point. I'm going to read it. We want to enjoy the times when the burden of disease in our community is low, and at the same time prepare for surges when the burden is more significant. So we're not saying it's all over. Let's get on with it. Let's forget it ever happened. We're saying relax a little bit, adjust what you're doing to accommodate your needs, but stay tuned, right? And be prepared. That's a really important message. I think we're all just going to have to get used to that. I want to thank our St. Clair County Health Department nurses. I always tell you how great they are, and I can't say it enough. But last month we put a small team together. I shouldn't say we. They put a small team together and went out to homebound residents to provide COVID-19 vaccine boosters and whatever vaccine COVID series they needed. So thank you to our nurses for doing this valuable community service. And as usual, going above and beyond what you need to do to serve our community. Thank you very much. There are 2 upcoming community events. You saw them maybe if you were watching. There was a couple of the flyers on there. There is the Southside Spring Festival that will be coming up April 23rd, which is a Saturday. It's from 10 till 3, and it's at the Community Mental Health Building. The address is not with me, but I think everyone knows where the Community Mental Health Building is. It's on Electric Avenue, next to the dental clinic. And this is going to be a free event. It's going to be wonderful. It's being promoted and provided on behalf of many agencies, but more importantly, the local community itself. The Southside Initiative, SCORE, NAACP. They're all involved in promoting this event by and for the community itself. There's going to be a lunch for everyone, hot lunch, health screenings. There'll be family event. We have a big stage out in the back that has great entertainment, prize drawings every half an hour, and much, much more. The goal, of course, is to get people together and learn about their community and what they can do to be healthier, but also just to start that process of socializing and being together again, which I think is so, so important. The other event is coming up on May 13th, which is a Friday from 10 till 1, and that's a community resource fair. And that's been something that's been happening annually for a number of years. This is a free drive-through event that includes a mobile food pantry, personal care items, and resources, other family resources, resource bags. So I would encourage you to take a look at that. That's on our Facebook page, ladies. The
Yep,
flyers.
it is.
Okay, so you'll find it on our Facebook page and take advantage of these wonderful opportunities. Um,
All
okay,
right. Well, let's move to
next.
the questions that we previously received, and then we'll move to the live questions. Okay, the first question that came in was fully vaccinated, one Johnson and Johnson plus one Moderna booster, 79-year-old taking high blood pressure medication, missing grandchildren, and unvaccinated family members. Is the CDC transmission rate still too high to start getting together with unvaccinated members safely for me?
Okay. So as I shared, I'll just review that again. The CDC rates, we say they're high, but it's based on a case rate of 200 per 100,000, and we're well below that. The reason we're still high is because of our hospitalization rates, which are still slightly above that threshold. Um, So we're high, but we're not high in the way that we were in the past when we were posting those numbers and we had actually there were 4 divisions and each time we went up. So when we got up to the high rate, we were quite high. So we are going to ask everyone to think about this in a personal way. What so you're fully vaccinated, which is great for you. You have the need to see your children, obviously. You want to see your children and they need to see you as well. Um, I'm assuming nobody's ill, nobody's immunocompromised. If there are people who are ill, we'd still recommend you test them or test yourself before you go. I mean, don't go somewhere where you're going to interact with people ill unless you know it's not COVID. Okay, so COVID tests are everywhere. Get a COVID test, and if you're really still concerned, throw that mask on. But other than that, we would encourage people to start interacting with each other because it's important for our recovery. And you just have to address how vulnerable are you? How vulnerable are the people around you? Is it inside or outside? The old adage still is true. Good ventilation is still very important. If you're inside, can you open the windows up? Ideally, outside is even better. Um, Closer you are together, the riskier it is if a person is shedding virus and doesn't know it. But those hugs are pretty important. And hugging somebody for a minute or two is, I think it's worth it if you're really concerned. Oh, wash your hands, wash your hands, wash your hands, right? So I think it's doable. I absolutely think it's doable. And I think people have to start. Those of you who have been really holding back on doing anything social for fear, now is the time to start venturing out a little bit and starting to get kind of your sea legs back. You don't have to go hog wild and go to big parties with no mask and no protection. Obviously, we prefer you to be vaccinated and do your due diligence and know who you're with. But besides that, it's a good time to start being with people again.
Okay, the second question that came in was, I work in a public service job that caters primarily to children, many of whom still aren't eligible for the COVID vaccine. Our team has been wearing masks to do what we can try to do to help keep kids safe. With the county technically in a recovery period at this point, is it reasonably safe for the kids, for us, to stop wearing masks, or would it be more responsible for us to continue to wear them?
Yes and yes. Uh, so, so again, according to the CDC, the community settings such as schools and that may include like schools for little kids or daycare settings, high-risk congregates settings like correctional facilities, homeless shelters, hospitals. They might benefit and probably will continue to benefit from ongoing layers of prevention based on the information we have and based on those facilities' needs. So at all levels, you need to think about that. Is a mask a good idea? Now let's face it, little kids, they can't get vaccinated. They also have very low risk of serious disease. Hopefully, those in their households, their parents and their caregivers are vaccinated. Remember that adults being vaccinated protect kids. Not only that, but it protects your kids bringing home things to you that will put you at risk. So that's obviously a strategy you want to do. Obviously, and the question is, if you have kids who are symptomatic, who have screened positive, if there is high risk of exposure, say there's a little outbreak going on in that setting, you absolutely want to put your masks on and be absolutely comfortable that you're following all the mitigation strategies you can. But if it's a different type of setting, they're widely dispersed, no one's ill, there's been no one exposed, then using going in without a mask, particularly if it's not a high risk, close, prolonged encounter, is something that you could consider, and you should consider that with your facility or your agency. Okay, so in many cases, we are going to continue masking. I can tell you what we'll do as a health department. We're going to continue masking anytime we have a close client to staff interaction. We say close, we're talking 6 feet or less, 15 minutes or more, which is essentially in our clinic room providing care. All right. Situations, just walking by in the hallway, I don't believe we're going to maintain that masking process. There are going to be some people who are going to choose to continue to mask because of their personal situations, their medical history, or their vaccination status. Others, maybe not so much. So these are decisions that need to start being made based on the individual situations. If there's problems, that's what we're here for. Give us a call. We'll talk through it. We'll try and guide you with best practices based on the situation you have. And there is no longer any black or white answer for this, which is, I know, going to be a little hard after people telling you, do this, do this, do this. Some of you hated that, some of you loved it. But the bottom line is, I don't think there's going to be a lot of, you have to do this at this point. There's going to be a lot of, this would be the best practice. This is something that would be the most protective. This is the least protective. You decide what you want to do in between. It's kind of a non-answer, but I hope I answered it, because this is coming up a lot. And all I can say is, if you're in a high-risk situation with vulnerable people and you're going to be close to them longer than 15 minutes, closer than 6 feet, mask wearing is absolutely still a good idea. Still should be considered and done. Okay.
All right, we'll move over to the live feed now. Sheila says, we appreciate all that you do. Becky reported that we were frozen for a bit. I don't know if IT has noted that or not, but it looks like
Were
we're
we
better now.
frozen? What did you
Better now.
miss? I'm sorry.
That's
I can't
okay.
repeat myself because I just wander.
She did report that it was better. Okay.
Good.
Susie said, thank you for all you do. Amanda asked, do you know when they will lift the mask at hospital settings?
No, I don't. And that is actually a conversation I'm having right now with some of our hospitals. I think at this point, with the CDC still having us technically in a high level, I think we're going to be a little slower. Hospital settings are where sick people go and highly vulnerable people are. So I think we have to be a little more careful with that. So that is a process, I think, that's just in transition right now. I can't give you a date.
Okay, we kind of already covered this, but Linda had said, due to posting once a week, that she must mean our Friday weekly reports. How would we know when St. Clair County changes into a different color on the CDC chart? I believe we were in the high red color and should be wearing masks. And you had covered that earlier in case she had missed that.
So will we be changing our website after the CDC changes theirs? I would assume, right? I'm not sure that we've decided when we're going to adjust we're still doing daily, by the way. So believe me, when we decide to reduce the frequency of our updates, they will be done to accommodate the best information available at that time. So if CDC is changing their graphs on a Monday, we would wait till they change their graph to change ours. Was that right? And of course, we will have, that's a really good point, Brandon. We will have also always links directly to these sites that are also that we're using. So the CDC and the MyStart maps will also be linked. So you can always go there and see what those other locations are saying about that.
All right. Thank you for all you do. Several people had said. Some people even said that they miss watching the show weekly, but for now we're on a monthly basis, and we'll be talking about other topics too along the way besides COVID as things transition. Maureen, thank you for your professionalism, integrity, and loyalty. Many people appreciate it. Pam asked, to swivel back to your comment about vaccines, Pfizer has released its first of many required documents on the safety of the vaccine. It's a 344-page document which consists of thousands of adverse events. Why have you not addressed that or begin to tell the public how to treat COVID with other options?
That's an interesting question. Well, if you haven't read the 344-page document was just released, I'll take a look at it. But those are documents that are they publicly released or are they released to the FDA? Okay, so I'll get back to you about that.
Somebody else kind of had the same question too.
What's that? Okay, so and how to treat COVID without other options. So treating COVID has I believe we've covered this before, but we can cover it again. So if you test positive for COVID, you have two choices at that point. You can consider your risk, and your risk would be much greater, of course, if you haven't been vaccinated. So that's one consideration: underlying medical conditions and your age. And you can choose to just kind of weather it out at home. You can use vitamin C and zinc and vitamin D and fluids and rest and Tylenol and just kind of wait it out and monitor for any worsening symptoms. You can also contact your physician if you're so inclined and discuss with them, him or her, whether you'd be eligible for one of our antiviral treatments that's been approved for COVID. They have to be given within the first 5 to 7 days, and or the monoclonal antibodies, which have to be given within 10 days. So what we do is at that point, leave the decision up to you and your provider, and then he or she can direct you to where you can access these treatments.
Okay.
I hope I answered that question. Yeah.
Megan asked, are high hospitalization rates correlated to the number of unvaccinated citizens?
Absolutely. You mean the high vaccination rates for COVID? There's no doubt that unvaccinated people get hospitalized more frequently for COVID than others. Now, there's a lot of discussion and a lot of data digging right now on all-cause mortality and all-cause morbidity during COVID, because COVID has some nasty implications outside of just respiratory infections and pneumonia. It's got an inflammatory component that affects blood clotting and liver and kidney function, etc. So I surely expect to see other hospitalization rates for other causes also increase during this COVID time. But there's no question that the fully vaccinated people are hospitalized less frequently than unvaccinated people for COVID. It works. It works.
Okay. You already answered. Are we still a red county? Jenny says, thank you for all you do. Your amazing leadership has been greatly appreciated. And Bonnie asks, this is our last question. Are you going to write a book on your experiences as a public health official going through a pandemic, political pressures, and more?
Hi, Bonnie. No, first thing I'm going to do is take a little break. I'm going to take a little vacation and try and feel normal again. And well, the first thing I'm going to do is make sure that this health department continues on a steady and positive course. We do important work, and it's absolutely important that we continue to do all that work and all the fidelity and integrity and expertise we've done all along. So that's my first role. I will do that until I'm confident and satisfied that this health department is running full ship ahead, or full steam ahead, I should say. Then I'm going to take a little break, and then I will see what doors open. And I am a woman of faith, and I do believe that doors open and close for reasons that we don't always fully appreciate. But I'm confident that it'll become apparent to me what we should do next. So thank you for that.
Okay. One more question from Nikki. She asked, is there a way for the doctors in the community to discuss what they are seeing with COVID patients and learn from each other, including ER doctors?
Well, I've tried. I've made that's one of the things that I've tried very hard as a medical health officer, being part of the medical community. That was an advantage I think we brought to the table. And I held weekly COVID calls to all physicians through a Zoom process. They were welcome to join. At times we had a lot, 60 to 100 physicians joining, and other times we've had just a handful. But we have held those conference calls now for 2 years. They obviously aren't going to continue necessarily at this point, but we'd be more than happy to reconvene those calls as soon as they're necessary. Now, our hospitals also have training. We've brought in many COVID specific training programs for our physicians on vaccine, on treatment, on COVID disease. So we're trying, and we're doing the best we can to keep everybody updated on a constantly changing disease process. So
All right.
it won't stop.
Just to end, Doc, there's no more questions, but just one comment from Marion, Julia. If you go back to being a doctor, let me know. I would love you as my doctor. So that's very
Thank
kind.
you.
And we thank everybody for all the nice things today. We'll be back in 1 month, second Thursday of April, and we'll be talking about just a COVID update and other topics as well. So see you then.